and the ear today. Okay, so let's start with the nose. So the nose consists of two parts. So you have the external part and you have the nasal cavity, which is enclosed by the external part of the nose. Okay, so starting with the external nose, the external nose is described in 4 parts. So you have a root, okay, this part, which is continuous with the forehead. So that's the root. Then you have a base, which is formed by the nostrils or the nares. And then you have a dorsum, that is this part. So that is formed in the midline, right? So that has a bridge in the upper part. That is this part, that's called the bridge. And this part here is called the tip of the nose. And then you have the ala, that is this part, that is a wide lateral part, you call the ala. So that is formed by bone and by cartilage and also by fibrofatty tissue. Okay, so the external nose is formed by 4 parts. That is the root, that is this part at the top, which is continuous with the forehead. The base, which is formed by the nostrils. This part here, which is called the dorsum, which is formed of a bridge in the upper part and the tip of the nose in the lower part. And then the ala of the nose, which is formed by these cartilages and by fibrofatty tissue. Okay, so that is the external surface of the nose. So this is obviously covered by skin, and the skin has a nerve supply from the anterior ethmoidal nerve, the infratrochlear branch of the nasociliary nerve, and nasal branches of the infraorbital nerve. So I tried to find a picture to help us at least picture this, but there was nothing that I could find properly. So I don't know how exactly we can remember this, but just anything with that word nasal obviously means nose. So all that will innervate this external nose. And then the blood supply is from the dorsal nasal artery, which is a branch of the ophthalmic artery, and by the external nasal artery, which is a branch of the anterior ethmoidal. So this external nasal artery and external nasal nerves, both from the anterior ethmoidal, supply the external nose. And it's also supplied by the lateral, nasal, and septal branches of the facial artery. Okay, so that is the skin of the nose. So now let's look at the nasal cavity. So in the nasal cavity, you have a lateral wall, then you have a roof, a floor, and the medial wall, which is the septum of the nose. Okay, so let's start with the lateral wall. So descriptively, the lateral wall we say is mainly made up of the maxillary bone. So this in purple, that's the maxillary bone. So that is the main constituent of the lateral wall. Then the gaps that the maxillary bone leaves is filled in by these other bones. So going from posterior to anterior, right at the back, you have the medial pterygoid plate of the sphenoid bone. This is the medial pterygoid plate of the sphenoid bone. Then anterior to that, you have the perpendicular plate of the palatine bone. So this is the palatine bone, right? It forms the posterior part of the hard palate. So from that, you have this part called the perpendicular plate. So that forms the lateral wall of the nasal cavity. Then at the top, you have this part that is formed by the sphenoid bone. And then anterior to that, you have this, which is called the labyrinth of the ethmoid bone. So the labyrinth has these projections called concha. right? So these are called concha. This is the superior concha and this is the middle concha. So these are basically projections into the bony cavity, into the nasal cavity from the bone itself. So you have the ethmoid bone here, the cribriform plate, and then there is this part that projects into the nasal cavity, which is the labyrinth. And the labyrinth has these two additional projections called the superior concha and the middle concha. Okay, and then underneath that you have this separate bone, which is the inferior nasal concha. So in total, you have three concha which are there in the wall of the lateral wall of the nasal cavity. That is the superior and middle from the ethmoid bone, and a separate bone which is the inferior nasal concha. Okay, so if we look at it in a CT, these white things, these are the concha. So under these concha, you have these spaces. You can't see it in that diagram that I showed you before, but here when we are looking at it from an anterior coronal section, you can see these parts here, the white parts, those are the concha. And then underneath that, you have these things called meatus. So under the superior concha, you have the superior meatus. Under the middle concha, you have the middle meatus. And under the inferior concha, you have the inferior meatus. Okay, so there are a lot of structures that come from outside the nose, which enter the nasal cavity through these meatus. Okay, so here, these are the meatus, and then you can't see it here, but underneath these projections, you have these meatus. Okay, so these are the concha. Then in front of that, we spoke about the maxillary bone. Then here you have a small part of the lacrimal bone. Then up here, you have a part of the frontal bone. Then here you have the nasal bone, the major alar cartilage, sorry, the lateral cartilage, the major alar cartilage, and the minor alar cartilage. So we didn't look at that when we were doing the external nose, but so here, these are the two nasal bones. And then the rest of the nose is, external nose is not made up of bone, made out of cartilage and fibrofatty tissue. So here in the middle, you have this cartilage called the septal cartilage. Then the septal cartilage have these two processes called the lateral processes that form the lateral sides. Okay, so this is the septal cartilage, and on the two sides, you have the lateral process of the septal cartilage. Then in front, you have this big cartilage that is called the major alar cartilage. So the major alar cartilage has this part here, which is called the medial crust, that forms the tip of the nose. And then on the other side, you have the lateral alar cartilage. Then between the lateral process and the major alar cartilage, sometimes you have this thing called the accessory nasal cartilage. So this is not always present. And then right on the side here, connected to the maxilla, you have the minor alar cartilage. So usually there are about 2 or 3 in number. And then between the major alar cartilage and the minor alar cartilage, this space is filled with fibrofatty tissue. So if you touch your nose, you can feel that the space on the side is flexible, more flexible than these other parts. That's because you only have fibrofatty tissue here. You don't have cartilage or bone. Okay, so that lateral cartilage here forms the part of the lateral wall, and then here we spoke about this, the major alar cartilage, the accessory cartilage, and here the minor alar cartilage. So let's go over it again. At the back, the medial pterygoid plate. Then in front of it, you have the perpendicular plate of the palatine bone. Then the ethmoid bone with its labyrinth and the superior and middle nasal concha. Then the inferior nasal concha, the frontal bone, the nasal bone, the maxillary bone, which forms the major part, a small part from the lacrimal bone, and these cartilages, the lateral, major, accessory, minor, and then the fibrofatty tissue. Okay, so I forgot to talk about the extent of the nasal cavity. So the nasal cavity extends here from the nostrils or the nares to the choane. So the choane is this. This is the choane. The choane are the spaces that are formed in between the medial pterygoid plate of the sphenoid bone and the vomer. Okay, so the vomer, we'll talk about it when we talk about the septum of the nose. So these two spaces in between those two bones is called the choane. So the choane will open into the nasopharynx at the back. Okay, so the nasopharynx communicates with the nasal cavity through this choane. Okay, so that is about the lateral wall. And then coming to the medial wall. So the medial wall of the nasal cavity is the septum. Right? So the septum is made up of two bones. That is, at the top, it's made up of the ethmoid bone. Here, it's made up of the ethmoid bone with its perpendicular plate. So this is the perpendicular plate of the ethmoid bone. That will form the superior part of the nasal septum. And then this is the vomer. So the vomer attaches here to the maxilla and to the palatine bone, and at the back it will attach to the body of the sphenoid, right? So at the back it's formed by bone, the perpendicular plate of the ethmoid bone and the vomer. In front it's formed by this septal cartilage. Remember we talked about the septal cartilage here? Okay, so this is the septal cartilage. So that will form the front of the anterior part of the nasal septum, right? So this is the nasal septal cartilage forming the anterior part of the nasal septum. Then we come to the flow. So the flow of the nasal septum, the flow of the nasal cavity is basically the roof of the hard palate. So the roof of the oral cavity, right? So this is the oral cavity here. So the roof of the oral cavity is the hard palate, right? So the hard palate is what forms the flow of the nasal cavity. So that's formed by the maxilla in front and by the palatine bone, the horizontal plate of the palatine bone at the back. Then coming to the roof is formed posteriorly by the body of the sphenoid. So this is the sphenoid bone. It's formed by the body of the sphenoid. Then in front by the cribriform plate of the ethmoid bone, then by the frontal bone here, the nasal part of the frontal bone, and by this nasal bone. So this entire thing is the roof, right? So posterior to anterior, you have the body of the sphenoid, the cribriform plate of the ethmoid bone, the frontal bone, and the nasal bones. So that is the roof of the nasal cavity. And then, so we have to look at a few landmarks here. Right. Okay. So first is this one. So this is the sphenopalatine foramen. So the sphenopalatine foramen will open directly into the pterygopalatine fossa. So here we have the sphenoid bone, the palatine bone. So the pterygopalatine fossa is found on the other side, right? It's found exterior to this to these two bones. So this sphenopalatine foramen will be a communication between the nasal cavity and the pterygopalatine fossa. So any nerves or vessels that want to enter from the pterygopalatine fossa can enter through the sphenopalatine foramen. So the structures that come through this are the nasopalatine nerve and the sphenopalatine vessels, right? So two structures, that is the nasopalatine nerve and the sphenopalatine vessels, that is the artery and the vein. So those two will enter through this sphenopalatine foramen. And then you have this thing called the incisive canal. So that is a communication between the oral cavity and the nasal cavity. So through the incisive canal, you have two structures, that is the nasopalatine nerve. So remember the nasopalatine nerve came through this sphenopalatine foramen. So that will cross through the nasal cavity and it will enter the oral cavity through this incisive canal. So that's then the name itself, right? It's called the nasopalatine nerve. So it supplies the nose and also the palate. So it will enter the oral cavity and the palate through this incisive canal. And then you also have the greater palatine artery. Okay, so two structures here as well. That is the greater palatine artery and the nasopalatine nerve. Okay, then you have these. Remember we talked about the meatus. So there are different structures which enter each of these meatus. Okay, so let's go from top to bottom. So here we have the superior concha. So this space that is superior to the superior concha is called the sphenoethmoidal recess. Right? So this part here is called the sphenoethmoidal recess. It's tucked into the sphenoid bone and the ethmoid bone. So you can remember that easily. It's the sphenoethmoidal recess. So here we have the sphenoid sinus. So the sphenoidal sinus will open into this sphenoethmoidal recess. Right, so you see the hole here, so that's opening into the sphenoethmoidal recess. Then underneath this superior concha, you have the superior meatus. So this is the ethmoid bone, right, on the roof. So okay, so this is the ethmoid bone with the ethmoidal sinuses. So these will enter here into the superior meatus. Let's find another diagram. Okay, so here this is the sphenoidal, the ethmoidal sinus. So that ethmoidal sinus will open here underneath the superior concha, that is into the superior meatus. So that is here, right? Openings to. Okay, so this ethmoidal air sinuses, there are three parts. There is a posterior, middle, and anterior ethmoidal sinuses. So the one that opens here into the superior meatus is the posterior ethmoidal air sinus. Okay, so that's a posterior ethmoidal air sinus. Then here, this is the middle concha. So in the middle concha, below that you have the middle meatus. Right, so in this middle meatus, you have this structure called the uncinate process. That is part of this ethmoidal bone. So between this uncinate process and between this part, which is called the ethmoidal bulla, the ethmoidal bulla is a structure that is formed by the protrusion of the sinus into the nasal cavity. So between the ethmoidal bulla and the uncinate process, you have this thing called the hiatus semilunaris, right? So it looks like it looks crescent-like in shape, so you call it the hiatus semilunaris. So into this hiatus semilunaris, there are two structures which open. That is the frontal, the duct of the frontal sinus. So this is the frontal sinus, right? So that will open here into the hiatus semilunaris, and also the duct from the anterior ethmoidal air sinus. So both of those will open here into the hiatus semilunaris. Then the opening of the middle ethmoidal cells is here in the ethmoidal bulla. And also you have the opening of the maxillary sinus here. Okay, so this is the opening of the maxillary sinus. So here you have four openings. One is the anterior ethmoidal and the frontal ethmoid, frontal sinus, which open in the hiatus semilunaris. then the opening of the middle ethmoidal sinus, and finally the opening of the maxillary sinus. So that will open here, right? Okay. Now, beneath that you have the inferior nasal concha. So below the inferior nasal concha, you have the inferior nasal meatus. So there is only one structure which opens there, that is the nasolacrimal duct. So we talked about the pathway of the nasolacrimal duct when they did the eye yesterday. So the opening of the nasolacrimal duct is here, right, in the inferior meatus. So those are the landmarks that we have to talk about here. So now let's come to the epithelium. The epithelium of the nasal cavity is okay. And one more thing. So this part here, this part at the inferior part of the nasal cavity is broader, right? So it's broader and there is more space between the floor and the inferior nasal concha. So because of that, when we intubate through the nose, the tube is usually passed here along the hard palate. If you pass it here, you will not have enough space. So we pass it here because the space is broadest here, and also there is more space between the inferior nasal concha and the hard palate. Okay, and now coming to the epithelium. So so the epithelium, here we have this part called the vestibule. So the skin of the nasal cavity will continue into the nasal cavity and line this vestibule. So this part here is called the vestibule. And this line here, we call this the Lehman nasi. So at this point, the skin will not continue anymore, and instead you will have the normal epithelium of the nasal cavity. That is the respiratory epithelium. Right? So the skin only extends up to this point line called the Lehman nasi, which is the superior extent of the vestibule. So here you have the respiratory epithelium, and on the superior part you have the olfactory epithelium. So the olfactory epithelium, as we know, is neuroepithelium. So it contains neurons, and also it contains supporting cells. The rest of the nasal cavity is lined by the respiratory epithelium, which is pseudostratified ciliated columnar epithelium, right? So along with that, you have a few subepithelial, mucus, and serous secreting glands, right? So when we talk about the nasal cavity's functions, we say three things other than the function of smell. We say that it traps particles, it moistens the inspired air, and warms the inspired air. So these mucus and serous glands are involved in that. So the mucus will trap particles, dust particles and all that, and it will, through the cilia, it will push these particles through the nasopharynx to be swallowed. Then the serous secreting glands, they secrete serous fluid which will moisten the inspired air. And also the nasal cavity is very vascular. So because it's highly vascular, it can warm the inspired air. Right? Okay, so now coming to the blood supply. So there is a plexus in the nose called the Kesselbach's plexus, right? So the Kesselbach's plexus is okay. So the Kesselbach's plexus is here. It's formed on the lower part of the septum of the nose. So it's formed by three arteries. It's formed by the greater palatine artery, which enters to the incisive canal. Then it's formed by the septal branches from the superior labial artery, which is a branch of the facial artery. So that comes through the nostrils, right? It comes through the nostrils. And then from the sphenopalatine artery. So these three arteries will form a plexus here, which is called the Kisselbach's plexus. So again, the three arteries are the sphenopalatine artery from the sphenopalatine foramen, the greater palatine artery from the incisive canal, and the superior labial artery from the nostrils. They enter from the nostrils. So these three will form this Kisselbach's plexus, which is located in the lower part of the septum. So because this plexus is located here, this site is a common site for nosebleed. So the clinical term for nosebleed is epistaxis. So this site here is a common site for epistaxis, right? And also, other than this, you have the anterior and posterior ethmoidal branches from the ophthalmic artery. Those enter through the orbit, right? So you have 5 arteries basically: the anterior and posterior ethmoidal arteries, the superior labial artery, the greater palatine artery, and the sphenopalatine artery. So the venous drainage, so veins accompany these arteries. So you have the same veins, and these will drain to the pterygoid plexus, facial vein, and to the ophthalmic vein. Okay, so that is the blood supply. Then coming to the lymph drainage, lymphatics will drain to the submandibular, retropharyngeal, and deep cervical nodes. Then finally, the nerve supply is from the vestibular. So this vestibular area that we talked about at the front, so that is supplied by the intraorbital nerve. Okay, so here, inferior part of the internal nasal branches of intraorbital nerve. Then the respiratory area is supplied by the anterior ethmoidal nerve, anterior superior alveolar nerve, lateral posterior superior nasal branches from the pterygopalatine ganglion, and also by the posterior inferior nasal branches of the greater palatine nerve. So here you have the anterior ethmoidal nerve, then the posterior superior lateral nasal nerves here, and the posterior inferior lateral nasal nerves here. That is the respiratory part, and then obviously the olfactory part is supplied by the olfactory nerves. Right? Okay, so that is all for the nose. So after this is the ear, so I'll start that in like 5 minutes. Okay, so before we start on the anatomy of the ear itself, because the ear is located in the temporal bone, let's look for the anatomy of the temporal bone. Okay, so the temporal bone has these different parts. So looking at it from a lateral view, you have the squamous part here. So this part forms the temporal fossa and the infratemporal fossa, along with the zygomatic process. So the zygomatic process is what articulates with the zygomatic bone in front. So that is the squamous part. And then at the back, you have the mastoid part, or the petromastoid part. So the petro part is on the medial side. Looking at it from an external part, it's mainly the mastoid part. So the mastoid part has this mastoid notch, which you can feel behind, mastoid process, and this mastoid notch, which you can feel behind your ear. And you have this tympanic part. Okay, so this is the tympanic part. So this tympanic part is this triangular area. So this tympanic part, yeah, this is the tympanic part, and then below the tympanic part, you have the styloid process. Okay, then looking at it from the medial side, you have the squamous part here. This is the squamous part, right? So this is the squamous part here. And then here you have the petrous part. So the internal auditory meatus, that's this. The opening for that is situated here in the petrous part. And this diagram is not completely accurate, but if you take it, this is the external auditory meatus, right? So this external auditory meatus is formed superiorly by the squamous bone. So here they're showing it in blue, saying that it's the tympanic bone, but it's actually formed superiorly by the squamous part of the temporal bone, and inferiorly it's formed by the tympanic part, right? So that is the bony anatomy. Then here, let's just look at how some things are located before we actually go in. So here we have the tympanic bone here. This is the external auditory meatus. So the tympanic bone is here. And then you have these other structures that surround the ear. So these, we need to know this because they are the relations of the ear, and during infections, fractures and all that, these structures can get affected. So here you have the carotid artery, the jugular vein, the facial nerve, geniculate ganglion of the facial nerve, and the sigmoid sinus. So we'll talk about this later, these how they are related exactly. But just remember that these structures are closely related to the ear and to the individual parts of the ear. Okay, right. So okay, so this is the ear, this entire part from the pinna to the internal auditory meatus. This entire part is the ear. So the ear, we divide it into three parts: the external ear, middle ear, and the internal ear. So first, look at the external ear. Okay, so the external ear is composed of two parts. That is the pinna, that is this structure that protrudes to the outside, and the external auditory meatus. Okay, so the pinna is formed by yellow elastic cartilage. Okay, so this is your pinna, and it is formed by yellow elastic cartilage, which is arranged in folds in such a way that you get this shape. Right? So because it's yellow elastic cartilage, this part is very flexible because obviously it's not made of bone. And then here in the inferior part, you have this part called the lobule. So that part is made up of fibrofatty tissue. So that is why it's easy to pierce. And that's why this is the site for piercings and all that. So here you have the fibrofatty part. The rest of the ear is made up of yellow elastic cartilage. Okay, so here this yellow elastic cartilage, this pinna is divided into different areas. They said that we don't really need these areas, but just to look at it, you have the outermost part, which is called the helix. Then this part, which is called the antihelix, that is the inner part. Then this part is called the antitragus. And this part is called the tragus. So it's basically what's opposite to each other. The helix, and opposite to that you have the antihelix. The tragus, opposite to the tragus, you have the antitragus. Then this is the crura of the antihelix. So it comes like this, and then it forms the antihelix. Then you have the concha here. This inner part is called the concha, and the
slides are not visible.
Okay. Give me a minute. See it now?
Yeah.
Okay. Sorry. So I'll just say that again. So this part is the lobule, which is made up of fibrofatty tissue. Then the rest is made up of yellow elastic cartilage. So this is the helix. Opposite to the helix, you have the antihelix. Here is the tragus. Opposite to the tragus, you have the antitragus. And inside here, you have the concha, and the concha will open into the external acoustic meatus. Right? So the pinna is supplied mainly by the facial nerve and the vagus nerve. Okay, so the facial nerve and the vagus nerve. And also by the great auricular nerve, auriculotemporal branch of the mandibular nerve, and the lesser occipital nerve. Okay, so at the back here you have the great lesser occipital nerve, here you have the great auricular nerve, the auriculotemporal nerve, and these parts are supplied by the facial nerve and the vagus nerve. So that is the pinna. Now going on to the external auditory meatus. Okay, so this part here, this is the external auditory meatus. So this is made up of both bone and cartilage. So the outer third is made up of cartilage, and the inner 2/3 is made up of bone. Right? So here the cartilage, this part, right? This is the cartilage. So the cartilage will form the external 1/3. This cartilage will form the external 1/3 and it will be attached to the bone here, which forms the external auditory meatus. Right? So this is the meatus, cartilage, and inner to that you have the bone. So the bone, remember we said that inferiorly it is made up by the tympanic part of the temporal bone, and superiorly it is formed by the squamous part of the temporal bone. Right, the external auditory meatus. Okay, so this external auditory meatus is covered by skin. So the skin of the pinna will continue inwards to line the bone and the cartilage. And the skin here has hair and sebaceous glands. Here in the cartilaginous part, it has hair and sebaceous glands. And also you have these glands called the ceruminous glands. So these are modified sweat glands, and they are the ones that secrete earwax. Right? So these are called ceruminous glands. They are modified sweat glands. Okay, so another thing you have to know is that because this tympanic membrane, that is the medial boundary of the external ear, this tympanic membrane is not straight. It's located obliquely. So because it's located obliquely, the antero-inferior wall will be longer than the posterior-superior wall. So this posterior, you can see that here in this diagram, right? The posterior-superior wall is shorter than the antero-inferior wall. That is because of this obliquity of the tympanic membrane. Okay, so talking about the arterial supply. So it's supplied by the superficial temporal artery, the posterior auricular artery, and the deep auricular artery from the maxillary bone. So there are three arteries, that is the superficial temporal, posterior auricular, which are both branches of the external carotid, and the deep auricular branch of the maxillary artery. Okay, and then the nerve supply is by the facial nerve through communication with the vagus, the great auricular nerve, which is a branch of ansa cervicalis, the auriculotemporal nerve, which is a branch of the mandibular nerve, and the auricular branch of vagus. So there are 4 nerves and 3 arteries. Okay, which supply the external ear. So, okay. So now let's go to the middle ear. Okay, so here this is the middle ear. The middle ear is basically a cavity in the temporal bone. So the part that you have here is the petrous part of the temporal bone. So the middle ear is basically a cavity in the petrous part of the temporal bone. So how it was formed was that this is the auditory tube which connects the middle ear and the nasopharynx. So because this auditory tube extended into the ear cavity, it ended up forming this cavity in the bone, which is our middle ear. So the boundary of the middle ear is from the tympanic cavity here to the lateral wall of the inner ear. Okay, so first let's look at the tympanic membrane. Okay, so this is our tympanic membrane. So the tympanic membrane is basically a thin fibrous tissue. Okay, so it's a thin fibrous tissue and it's covered externally with a thin layer of stratified squamous epithelium and internally with low column epithelium. So obviously on the external surface it's covered by stratified squamous epithelium because the skin lines the external ear, right? So the skin is basically keratinized stratified squamous epithelium. So this tympanic cavity, tympanic membrane is also lined not by keratinized, but just stratified squamous epithelium. And on the inside, it's lined with columnar epithelium. Okay, so it's a circular membrane and it lies obliquely at 55 degrees, right? So that we talked about how these walls are not symmetrical because of the obliquity. So it's inclined at 55 degrees to the external acoustic meatus, right? So through this tympanic cavity, you can see the bones in the middle ear. So we know that the malleus, this is the malleus, this is the incus, and this is the stapes. So the malleus is attached to this tympanic membrane on its inner side. So you can see how it's attached. See the handle of the malleus. You can see that attachment through this tympanic membrane. And there are 2 processes of the malleus. And from this process, there are 2 thickened fibrous folds. Okay, so there are 2 thickened fibrous folds. And between these 2 fibrous folds, there is this part which we call the pars flaccida. So here you have the anterior malleolar fold. Here you have the posterior malleolar fold. So in between these 2 malleolar folds, you have the pars flaccida. So it's called the pars flaccida because it is it's loose, right? It's lax. It's not held tight. So because of that, we call this the pars flaccida. Then below that, we have this part which is called the pars tensa. So this part is not lax, right? It's held tense. So because of that, we call it the pars tensa. So the reason that this is tense is because it is held tense by the inward pull of the tensor tympani muscle. So there is a muscle called the tensor tympani, which enters the middle ear, right here, tendon of tensor tympani. So this part is attached to this pars tensa. So this tendon, the tensor tympani tendon will hold this past tense are tense, right? Okay, so that is the tympanic membrane, and it is supplied by, the arterial supply is by the deep auricular artery. So that also supplies the external auditory meatus, the deep auricular artery from the maxillary nerve, right? So that, and it's supplied by the posterior auricular artery, which also supplies the external auditory meatus. So it's supplied by those two arteries, and these two arteries, they form an anastomosis around this tympanic membrane, along with the tympanic artery of the maxilla. So the first two arteries, the arteries that supply the external auditory meatus, and in addition to that, you also have the tympanic branch of the maxillary artery. So these three will form an anastomosis around the tympanic membrane, and it will supply the tympanic membrane. Then the nerve supply is from the auriculotemporal nerve, the vagus, that is the auricular branch of the vagus nerve, and also the tympanic branch of the glossopharyngeal nerve. Okay, so those three will innervate the tympanic membrane. Okay, so now coming to the middle ear. Okay, so this is a simplified version of the middle ear to make it easier. So this cavity of the middle ear is also called the tympanic cavity. Okay, so we talked about its lateral wall, which is the tympanic membrane. Now let's talk about the other walls. Okay, so the medial wall is the lateral wall of the inner ear. So on the medial wall, you have this structure called the promontory. This promontory is formed because of the bulge of the cochlea. So the cochlea is on the other side, right, in the inner ear. So the first turn of the cochlea will bulge into the middle ear through this bone to form this structure called the promontory. So on the promontory, you have this plexus of nerves. So this plexus of nerves is called the tympanic plexus, and it is formed by the tympanic branch of the glossopharyngeal. Remember, we said that the tympanic branch of the glossopharyngeal nerve innervates the tympanic membrane. So this tympanic branch of the glossopharyngeal nerve, along with sympathetic branches from the internal carotid artery. So when I showed you the...
Sorry, Kasturi, I think your screen is just...
again, okay. Okay now?
Yeah, it's fine.
Okay, so yeah. So this tympanic plexus is formed by the tympanic branch of the glossopharyngeal nerve, sympathetic branches from the sympathetic plexus on the internal carotid artery. Remember this, when we were talking about the bony landmarks, we said that the internal carotid artery passes close to the ear. So from that internal carotid artery, you have branches, sympathetic branches which join this tympanic plexus. And also you have the lesser petrosal nerve. Okay, so these three together will form the tympanic plexus on this promontory of the middle ear. Then above the promontory, you have this oval window. So the oval window is usually covered by the stapes bone. Okay, so I'll show you that later, but that's covered by the stapes bone. And underneath that, below the promontory, you have the round window. So the round window is covered by fibrous tissue, which we call the secondary tympanic membrane. Okay, so that's the whole window. This is the round window. Then the roof. The roof is formed by the petrous temporal bone. Okay, remember I said that it's from the middle ear is situated in the petrous bone. So the roof is formed by the petrous bone, and this part of the petrous bone is especially called the tegment tympani. Yes, so this part that forms the roof of the middle ear is called the tegment tympani. So above this tegment tympani, you have the temporal lobe of the brain. Okay, so that is above this tegment tympani. Okay, then we come to the floor. So this floor is again formed by the petrous temporal bone, and right under this floor you have this internal jugular vein. Okay, and yeah, so that is the main thing here. Then let's talk about the anterior wall. So the anterior wall, you have these two structures which pierce it. So this is called the tensor tympani muscle. So the tensor tympani muscle, it starts from this tube, which is the auditory tube. It starts from the auditory tube and it passes to be inserted into the handle of the malleus. So remember we said that this tensor tympani muscle is what keeps the pars tensa tense. So it does that through this handle of the malleus. So origin is here on the auditory tube and insertion will be on the handle of the malleus. Okay, and this muscle is supplied by the mandibular nerve via its medial pterygoid branch. Okay, it's not that important. You just have to remember that this tensor tympani muscle pierces the anterior wall. Okay, then you have the auditory tube. So the auditory tube, it starts at the nasopharynx, and from the nasopharynx, it will enter the middle ear through this anterior wall. So the auditory tube is what maintains an equilibrium, a pressure equilibrium between the middle ear and the nasopharynx. Okay, then also this lower part here, you can see that right here, there are branches with sympathetic nerves from the internal carotid artery. Those will pierce this anterior wall, and the chorda tympani will leave the middle ear through this anterior wall. Okay, so the chorda tympani is a branch of the facial nerve. So the facial nerve is here. We'll talk about it soon. So this facial nerve will give off this chorda tympani, which will go through the middle ear, the cavity of the middle ear, and it will leave through this anterior wall. Okay, so the chorda tympani later goes on to supply the tongue and the submandibular and sublingual salivary glands. That is the chorda tympani. Then coming to the posterior wall. So the posterior wall, you have this part here called the adductus. So that is basically a deficiency in the posterior wall. So this adductus will communicate with the mastoid antrum. So I'll talk about that later. The mastoid antrum is located posterior to the middle ear. So the communication between the mastoid antrum and the middle ear is through this mastoid, is through this adductus. And also you have the facial prominence of the facial canal and the prominence of the lateral semicircular canal. So these two will form a prominence. These two are located in the inner ear. Okay, so these will form a prominence on this medial wall, and then they will pass, the facial nerve will pass out through this posterior wall, through the stylomastoid foramen onto the face. Okay, so again, like the internal cavity artery and the jugular vein, the facial nerve is also a close relation of the middle ear. So here we have the chorda tympani being given off. So this chorda tympani is what crosses the middle ear and pierces the anterior wall. Then you have this thing called the pyramidal eminence. So the pyramidal eminence is what gives origin to the muscle called stapedius. So this stapedius muscle will go and supply, that will go and insert onto the stapes bone. So that the origin of that muscle is on this pyramidal eminence. Okay, so that is the structures there. Okay, so this is how the middle ear looks when you are looking through the tympanic, after removing the tympanic membrane. So here we have the promontory, the round window. Then you can see the tympanic plexus here. You can see the chorda tympani nerve crossing the middle ear. And then you have these bones. Okay, so the bones. Okay, so these are the three bones, the malleus, incus, and the stapes. So here we said that the stapes closes the round window. Okay, so that's this.
Kasturi, I think it's stuck again.
Okay. Okay, so the three bones, that is the malleus, the incus, and the stapes. The stapes covers the oval window here, right? And here you can see the round window, which is covered by fibrous tissue. Okay. So that is the cavity of the middle ear. Now let's talk about the let's talk about the mastoid antrum and the mastoid air cells. Okay, so this is the middle ear, and remember it opens into the mastoid antrum through the adductus. So this is the adductus. Okay, so now we're looking at this from a lateral view. Okay, so this is the anterior, this is the posterior. So here you have the middle ear, which means that the mastoid air cells and the mastoid antrum are located posterior to the middle ear. Okay, so this is the mastoid process. So it makes sense, right? That the mastoid antrum and the mastoid air cells are located in the mastoid part of the temporal bone. Okay, and also remember we said the roof of the middle ear is formed by a part of the petrous bone called the tegmen tympani. So this tegmen tympani will also extend on the superior surface to form the roof of this mastoid antrum and the mastoid air cells. Okay, so that continues the posterior side to form the roof. Okay, so what we have to know about the mastoid antrum and the mastoid air cells is that when you're looking at it from outside, it corresponds to this part of the bone, which is called the suprameatal triangle. So we know where the external auditory meatus is located, right? So this is the external auditory meatus. So above this external auditory meatus, this part we call it the suprameatal triangle. So that is formed, the triangle you can actually see if you look at it from a bone, but this is a suprameatal triangle, and the mastoid air cells and the mastoid antrum are located deep to this. Okay, so it's located deep to this. Okay, so this mastoid antrum is the mastoid antrum is present at birth, but these mastoid air cells are not present at birth, and they are formed during the first year. Okay, so during the first year, you won't have this much. You will only have a few air cells, but progressively, as you grow older, these air cells will burrow through the mastoid bone, and sometimes it can even come up to the mastoid process. Okay, so the significance of this is that middle ear infections can spread here and cause infections in the mastoid air cells. Okay, which will block these mastoid air cells. Okay, then so that is the middle ear. Okay, now let's talk about the internal ear. Okay, so this part is the internal ear. So it is made up, again, it is found in the bone. It is found in the petrous part of the temporal bone. Okay, so right. So this is the inner ear, and this is the petrous part of the temporal bone. So the inner ear has it's divided into two regions, which we call the osseous labyrinth and the membranous labyrinth. So this osseous labyrinth is basically a tube. It's a tube which is formed by connected cavities. So you see these cavities in the bone. These are cavities in the bone, right? So these are all connected to form the osseous labyrinth. Okay, and then the osseous labyrinth is filled with fluid which is called the perilymph. And inside the osseous labyrinth, you have the membranous labyrinth. Okay, so the blue color tubes that we call the membranous labyrinth. So inside the membranous labyrinth, you have endolymph. Okay, so in the osseous labyrinth, you have perilymph. In the membranous labyrinth, you have endolymph. Okay, so this osseous labyrinth will communicate with the middle ear through the round window and through the oval window. Okay, so here you can see, right, the membranous labyrinth isn't connected here. It's just the osseous labyrinth that is connected here to the oval window and here to the round window. So it will communicate with the middle ear through these two windows, and above this you have the posterior cranial fossa. So it will communicate it will communicate with the posterior cranial fossa through the aqueduct of the vestibule. Okay, this structure here is called the aqueduct of the vestibule. So this bony canal here, so you can see that there is a tube going here, okay, but this, we call the space without the tube, we call it the vestibular aqueduct. Okay, without this membranous labyrinth tube, we call it the aqueduct of the vestibule. In humans, when we are living, okay, in life, this vestibular aqueduct is closed by this duct, which we call the endolymphatic duct. The endolymphatic duct is a part of the membranous labyrinth. So in life, this vestibular aqueduct is closed by the endolymphatic duct. So this endolymphatic duct, since it's connected to the membranous labyrinth, endolymph from the membranous labyrinth can communicate with the CSF through this vestibular aqueduct. Okay, so endolymph here can drain into the CSF through this vestibular aqueduct. Okay, so that is the osseous labyrinth. So now let's talk about the individual parts of the inner ear. So first, let's start with the cochlea. So the cochlea is a hearing apparatus, right? So this is the cochlea. It is a conical snail-shaped cavity. Okay, so this is the cochlea. It's a conical snail-shaped cavity. It consists of 2 3/4 spiral turns. Okay, so you don't have 3 complete turns, you have 2 3/4 spiral turns. Okay, so the cochlea okay, so the cochlea, it's a bit complicated, so I'm using these diagrams to explain that. They said that we don't need the inner ear in much detail, but I'll just do this to make it clear. Okay, so here we have the membranous labyrinth, which forms the cochlea. Okay, and we have this structure called the modiolus. Okay, so this is the modiolus. So this modiolus is a bony projection from the petrous temporal bone. It's a bony projection which projects into this inner ear. Okay, so this modiolus, the cochlea will spiral around the modiolus. Okay, here we have the cochlea straightened out just to show how it's connected to the modiolus. But if we look at it, how it actually is in our ear, the cochlear duct will spiral around it. Okay, so that's a diagram to show that. Okay, so this is the modiolus projecting into the inner ear. Then this modiolus has these outward projections called spiral lamina. So these are bony plates, outward projections of the modiolus, and the cochlea, the membranous part of the cochlea is located on this spiral lamina. So it will go like this. It will spiral. It will be located on this spiral lamina, and it will spiral around it. That is the membranous part. Okay. So just to show you how it looks. Okay, so if you look at it, okay, so if this is the inner ear, you have these parts called the spiral lamina which project like this, and the cochlear duct, that is the membranous part of the cochlea, is located on this lamina, spiral lamina. Okay, and okay, so here is how it looks. Another diagram. Okay, so this is the modulus. This is the membranous part. So this scala, so this spiral lamina of the modulus will project here. So you will see it here. Okay, here, here, and here. Okay, so right. Here is another diagram showing that. Okay, see, this is the lamina, spiral lamina, and on that you have the scala vestibuli, which is the membranous part of the cochlea. Okay, so so we know that we know the structure of the cochlea, right? We've done it in physiology. Hold on. Can you see it? Guys, if you can't see this, just let me know. Okay, so okay, so this is the transverse section of the cochlea. So we said that out here you have the bony part. Okay, this is the bony part, and this is the membrane. So the membrane of the cochlea, the one that is towards the apex, we call it the vestibular membrane, and the one that's towards the base, we call it the basilar membrane. Okay, so this is the basilar membrane, and this is the vestibular membrane. And this is the spiral membrane. So between these three membranes, you have the membranous part of the cochlea, which we call the scala media. Okay, this is called the scala media. So your organs, your organ of Corti and all that is located in this scala media. Then above the vestibular membrane and inferior to the bone, you have this part which we call the scala vestibuli. Okay, so that is part of the osseous labyrinth. And between the basilar membrane and the bony part, you have the scala tympani. So these two are part of the osseous labyrinth, and they are filled with perilymph. This part is part of the membranous labyrinth. It's enclosed by the vestibular membrane, the basilar membrane, and the spiral ligament called scala media, and it contains endolymph. Okay, so now talking about the nerve supply, we know that the vestibular cochlear nerve enters the ear through this internal auditory meatus. Okay, so this is the internal auditory meatus. The vestibular cochlear nerve enters through that. So once the vestibular cochlear nerve enters, it divides into a cochlear nerve and a vestibular nerve. The cochlear nerve will perforate this modulus. Okay, remember this modulus that we talked about before. So it will perforate this modulus. And after perforating the modulus, it will enter the cochlear duct through this spiral lamina. So remember we said that the modulus has these bony projections called spiral lamina, which project into the cochlear duct. So this will enter the cochlea through the spiral lamina. So we call this the spiral ganglion. So we have here nerve fibers coming from here, right? So the nerve fibers coming from the organ of Corti will come here. It will form this ganglion here. Then from the ganglion, you have nerve fibers going into the cochlear nerve, forming the cochlear nerve, and then back to the vestibular cochlear nerve. Okay, so that is the cochlea, then the vestibule and the semicircular canals. So this here is the vestibule. So you have the vestibule is made up of two parts, that is the saccule and the utricle. Okay, so this is the utricle, this is the saccule. So this vestibule communicates with the cochlea here. This is the cochlea, right? So you have the osseous labyrinth of the cochlea. So the osseous labyrinth of the cochlea will communicate with the osseous labyrinth of the vestibule. Okay, and yeah, so that is about, there isn't much about the vestibules that we have to know. So just have to know that you have the saccule and the utricle and its location in the inner ear. Okay, and then you have the semicircular canals. So there are three semicircular canals. There is an anterior semicircular canal, a lateral semicircular canal, this one here, and a posterior semicircular canal. So these three are located at right angles to each other. Okay, so remember we did this law called Maxwell's law during A-levels, where we hold the three fingers of our hands perpendicular to each other. So this is also like that. The three semicircular canals are located perpendicular to each other. Okay, so the semicircular canals and the vestibule are supplied by the vestibular cochlear nerve. So vestibular cochlear nerve will divide into the vestibular and cochlear nerve, and then the vestibular nerve will divide into a superior and a lateral. Okay, so the superior vestibular nerve will supply the anterior semicircular canal and the lateral semicircular canal, while the inferior will supply the posterior semicircular canal. Okay. Okay, so that's about the semicircular canal. And then talking about the blood supply and the nerve supply of the internal ear. The blood supply is from the labyrinthine artery. So the labyrinthine artery is a branch of the basilar artery. We talk about the basilar artery when we talk about the nerve supply of the brain. So sorry, the arterial supply of the brain. So this labyrinthine artery is a branch of the basilar artery, or it can also come from the anterior inferior cerebellar artery. Okay, so the labyrinthine artery comes from there, and then it enters through the internal acoustic meatus and divides into branches which will accompany the nerves. Okay, so these branches will accompany the cochlear nerve and the vestibular nerve, and will go on to supply the structures of the internal ear. The veins will form the labyrinthine vein. Labyrinthine vein will also leave the internal acoustic meatus, and it will go on to join the inferior petrosal sinus. Okay, so that will go out through this. So, and the nerve supply, as we know, is from the vestibular cochlear nerve. Okay, and another thing that we have to know is that this facial nerve, it also enters through the internal acoustic meatus. It will cross the internal ear. And remember, we said in the middle ear that it forms this prominence on the medial wall of the middle ear. So that's how this is formed, right? It comes to the internal ear, and here through this, it will leave the internal ear, form a prominence here, and then it will leave the skull through the stylomastoid column. So that is all about the ear. If you have any questions, you can drop me a text. Yeah, you can drop me a text.